So this video is about taking lots of bolstering technique and cushioning and supporting and putting it in one video so you could see, say, how to support client's body. The major issue is that the table is straight and our body is not. Body is curved, some people have overcurve or undercurved, so they might need different cushioning in order to make their body comfortable. Once their body is comfortable or an area is comfortable, then they can relax and you can apply, the technique that you apply will be absorbed a lot better. If you apply it when the client is not comfortable and their body is not supported, then you kind of massage against odds. The odd is that the muscles are not relaxed. Okay? So let's start from the top. And the client here do have clothes. It's not the idea of show you really how it works in real, but really to run through all kind of styles. So the most obvious one is underneath the ankle when they're facing up. Now, yeah. Now, oops, sorry. Yeah. Now, client always like that? No. So you can offer it. Yeah. So you can. This is a nice bolster. This is a half size bolster. So you put that, and you can ask, is it better this way? Yeah. Okay. So you can leave that. Next bolster, I will actually do with a towel, and that helps client with increased kyphosis when the shoulder is forward. So what you can do is fold the towel and then you place it underneath the shoulders. So if the shoulder is rolled forward, then you lift it and yeah, you can put it this way. Now, why I like towels sometimes, because if it's too much, all you need to do is just kind of open it. So you can do it in a bit less, yeah? This way, and you do it on both sides. For now, I will use another one, yeah? Now, good, okay? So, do you see what I'm trying to do?
Yes.
All what we've talked about, this postural imbalance, upper cross syndrome, where the shoulder is too forward. Sometimes the jokes that with my client I put them and they feel, oh, so much nicer, and I've said, okay, I'll come back in an hour. So just this position in a relaxed way, you can relax, yeah? In a relaxed way allows the muscles to stretch, pectoralis, major, minor, yeah? Serratus anterior stretch, and then you can work on the back in a very easy way. Okay? This I use quite a lot. Yeah? Now, sometimes it's a question whether to use a bolster or a towel. I like towels because you can change the height. Yeah? Bolster, this is the size, this is it. Yeah? So that's nicer. Okay? I'm going to take it off. Okay? Now, the next one is really around the lower back. So sometimes client comes and lie down when their lordosis is quite increased. They're not comfortable lying facing down. Usually I will put them sideline because it's quite risky if somebody is having an increased lordosis when they're lying down facing down. That means that the joint in the spine can irritate each other and they would have problems. And because I like sideline more, I will usually put them in sideline. But let's say they don't want or you don't want. So what you can do is take a towel and ask them to put it underneath their stomach. Why? Because then it would stretch the lower back. You see? If you put it underneath the hip, it will increase the lordosis. Does it make sense?
Yes.
Yeah, good. So the instruction would be as such. I'm going to ask you to lift a little bit and then put this underneath your abdomen. Yeah, you need to arrange it. You need to arrange it. Yeah, not underneath your hip, underneath your abdomen. Yeah, good, good. So what would it happen is that it would kind of drop the hip and stretch the lower back. Okay, only if it's short. Yeah, anything? No. All right. So this can be increased with. Remember we did the traction technique when you're holding onto the upper iliac crest and then stretch it. So that's one way to help. Yeah. Another incident is that some people, because of the increased kyphosis or because the breast is tender, either they're breastfeeding or it's too much pressure, then what you do is putting one cushion on the abdomen, another cushion is above the breast. So it kind of ease off. Yeah? So let's ask, can you lift yourself? And then put that right into here. Yeah? Like that. You might need to adjust the height, and you might need to come a little bit more upward. So you see, and that's what I think why a lot of people don't like bolsterings, because they need to move the client. Don't worry about it. It's better to move them for 10 seconds, and actually then the muscles is a lot more relaxed. There are some products who are kind of fitted to what I've said. Especially there is one with kind of abdomen and chest support that comes kind of ready. Yeah, more in, I didn't see them much in the UK, more in America. So I think we kind of covered the most of these bolsters. I just want to show you another one. Yes, and I'll ask you to come up, please. Come up and come up from here. Yeah, yeah. Stay like that for a second. Some nice technique, can I allow me to do that? Yes. And that's something that I kind of played, you can come and lie down. Something that I've kind of liked to experiment sometimes, with mobilization. Yeah? So sometimes I'm just going to take the top just so you can see what I'm doing. But sometimes in mobilization, you can do kind of interesting technique in which you can use the towel into really allowing quite nice, easy, either mobilization in which one hand mobilize, the other hand work on the erector spinae muscles. So very nice oscillation. It can be quite nice oscillation and very easy to do. Yeah? Yeah, so you can do that. Or more like a mobilization with deep tissue. Yeah, to just allow that. So it's really good for the ribs, for example. You can do it onto the ribs. Yeah. Sometimes you need to put their hand in there and then allow the shoulder to move also. You can see quite a lot of interesting way to make it easier to play with. Yeah, to allow them to relax while you're doing it. So, yeah, as well. You can do the same thing for the lower limb as well. So I think we've kind of finished. Yeah, come and lie onto your back facing up. Yeah, cool. So, yes, facing up. Facing up. Yeah. Good. So the most important one is really shuffle yourself a little bit down, a little bit more down. Yeah, thank you. Most important is to have the head support right. And you can just ask them, is it comfortable again? There is the pillow versus the towel. So there is this pillow, and I would suggest even that flatter pillow because you can do that and it feels more supported. And just to be sure, lift your head, you can kind of pop it up, down, So it kind of really feel fully supported around their neck, and they can rest their head. Even just to be sure, I will apply a little bit of pressure and move it to just be sure that it's supported well. Then I can go about doing other things. So I can use a bolster underneath the knee. Again, most people do like that. Yes, I will try to have something full size. Yeah, I don't like much. There is a bolster that is fully circled. Sometimes it's a bit too much. So try to have something that is softy. Memory foam is really good. Yeah. But really just, usually this pillow can work really good as well. You can roll it and then tie it, or, you know, it's soft, it's really nice. So where else you can apply bolsters? Sometimes on really rare occasion, I do put it underneath the hip. So if I put it underneath the hip, again, the lower back would sink into the table. But I don't want even to show it because I've rarely really used that. You can use the bolsters underneath the shoulder here. Now you're asking, actually, it's kind of the opposite of what we've done before, right? Before that, when the client lies facing down, we kind of stretch it. So why to encourage it? It's not so much to encourage it, it's more to just give a support. So yes, when they face down, there is a stretch. Now there is kind of a support, so it feels supported. You can do the opposite as well, especially, you know, there is a yoga bean bags. You can put kind of to have like a weight here. It's kind of nice to kind of have a weight and stretch the back. Yeah? I think besides side lying, that's about it. Yeah? Any other questions, or? The question was about if there is an increased lordosis, whether to kind of support that. The answer is, I would say, the approach would be different. If there is an increased lordosis, then what you do is lifting the knees higher. Yeah? So can you imagine what I will do? What would happen to the lordosis if you just put like that? So what happened, it's kind of tilt the pelvis this way. Yeah? Sorry. Yeah? So, yeah, that's increased lordosis. Yeah? That's it, really. Added to that, few more things. First of all, facing up, we can do again these technique with the ribs mobilization. So you can do very easy mobilization this way, or with the shoulder. Yeah, so you can kind of make it quite easier for you to kind of tilt them, bring them back. Yeah, because you just hold the towel very easily. Yeah. Taking more even, you can do, lift your head please. Yeah, thank you. So you can do the same for the neck. Yeah, so you can just hold the towel and kind of like stretching the neck, all really with the towel. You can lift it to the other. You can do very easy movement, yeah, very easy movement. Some people would like it, some don't, you know. And you can do a stretch, really nice. It's kind of like sometimes you need to put the towel only onto the suboccipital and then kind of holding it. Even you can kind of stretch the neck. Yeah, do you remember tractioning? Creating that. So I'm kind of put it on the the suboccipital. How was that?
It's okay.
Yeah, good. And then slowly moving it. Okay? You can do even sidelining. Sometimes it feels great. Sometimes you as a therapist need a bit of change. Sometimes it feels like a bit of faffing around with it, and why don't you just put your hands in here and do that? Some clients, funny enough, don't like the touch. They prefer to do it through towel. Some really miss the touch. So choose that. Okay? I think that's it.